Well, we stopped by Heart of Ohio Family Health Center to learn about how they are testing for COVID-19. I know there's been a lot of confusion out there as to whether you needed to get like a telemed referral before you could get a test. That's not the case here at Heart of Ohio. We learned all about it from Dr. Mohammed. Dr. Mohammed, so good to have us out, to come out and see one of the testing centers and one of the testing sites that are here. And we're anxious to learn about this because we're hearing so much in the media today about, there's not enough testing available, that kind of thing. And I know you guys have just won a big award and you're going to be doing a lot of testing here. So talk about that with our audience a little bit.
Absolutely. So we receive funding from HRSA, that's the federal award that we receive, to provide testing to our patient in the community. So we are wrapping up to increase our testing capability to test anybody who want to get tested in our community.
I think one of the things that you hear out there right now is the only way that I can actually get a test or find out if I've had it is I have to go on telemed or one of those services and have a doctor then refer me to a test. Not the case here, right?
No, not the case here. I mean, you can call our phone line to schedule an appointment, 614-235-5555, and then, you take your demographic information, you can come in here and get tested. And if you want some of the services that we provide to, because we are a primary care environment, and we can see you for your physical, for your diabetes, pregnant, we can see you, behavioral health, you have a substance use disorder, we can actually see you too. So you can establish care here on top of the testing that you will have as well.
Yeah. So what is the test? What do you go through literally to get the test?
I mean, currently the tool that we use an external lab called the LabCorp. So there's a swab that our staff, the nurse or physician, will actually poke through your nose to go a little bit deeper and then get your nasopharyngeal swabbing over there and then put it in the test tube. And then we ship it to the laboratory to go and analyze. So it's a little discomfort, but that is the test that we have right now.
Now, is it the same for if you just want to find out if you've had it? Is it the same test?
Yes, if you want to have that, if you have it, it's the same test. So there is an antigen testing and antibody testing. So the antigen testing is the test whether you have it. The antibody testing is the test that when you have had it, your body has actually show an immunity, so that one too could be found out.
Yeah, there was a lot of conversation about that immunity. What is your take on it?
My take on the immunity is that it's still a big unknown. It's still a big unknown. This is a new virus that we don't know a lot about yet right now. So we're not sure whether when you're exposed, you can get an exposure secondary. So we are hearing very, very recently from where this virus started in Wuhan, China. There are some few people that have had some kind of positivity after they've tested positive like in March. That's 2 months ago. So what does that mean? So we are not sure about this virus at all, the coronavirus. So we will actually be cautious as well, but definitely in the past, we know that when you're exposed to a particular virus, you are immune to that, and then you don't get the same virus again. But for this COVID-19, we are not very, very certain about what that means.
So Dr. Mohammed, what's your take of reopening Ohio amidst this COVID-19 virus?
Right, so my take on reopening Ohio is, I support exactly what our governor is doing, and Dr. Amy Akin, they are really giving us a good guidance about how to do this opening, and I support that. So when we open, we have to do it cautiously, like wearing a face mask when you go to a business, social distancing like we're having right now, 6 feet apart. So definitely, and so that the business part of the society too will come in, as well as the healthcare environment.
Well, Dr. Mohammed, where can we learn more and come and get a test to find out whether if we've had it or if we do have it right now?
Absolutely. So, you can go to our website as heartofohiofamilyhealth.org, heartofohiofamilyhealth.org, or call our number 614-235-5555 to talk to any of our customer service and to get an appointment to get your test.
How quickly can we get the results?
Right now, we're running between 2 to 4 days.
Okay, great. Thanks so much for being on the show.
Thank you.